Thank you, Deputy Speaker. I rise in support of the Treasury Laws Amendment, Genetic Testing Protections in Life Insurance and Other Measures Bill 2025. I just can't let it pass that the member for New England mentioned 105 males born, but sometimes in a good season you have more, sometimes less. Anyway, he's left the chamber, so I don't feel the need to continue that. I'd say when I was elected, I made a commitment in Ford to listen to the community, to fight for what I hear, and to deliver on what the community wants. And so, to that end, I came across a woman called Jess Short, who lives in Waterford West. Jess has a rare condition called osteopathia strata with cranial sclerosis. It is a rare disease. Jess is somebody who is a fierce advocate for people with that condition, but is also a fierce advocate for people with rare diseases. And so, as part of working with Jess, we held a community forum in Ford last week on rare diseases. And from that, it really, I think, has emerged of how significant rare diseases are in our community. That even though each of them have a propensity in the community of about 5 and 10,000, collectively there's something like 7.8% of the Australian population living with a rare disease, which means in Ford that's somewhere of around 13,500 people. So Jess, and I'd just like to read a bit about Jess. So Jess was unofficially diagnosed at around 12 years old. When she later sought a formal diagnosis, she says that she was told she couldn't have children, and that advice was delivered without much empathy. 6 weeks later, it was confirmed that she did in fact have the condition. Much of Jess's childhood was spent in and out of hospital, and by the age of 18 she'd undergone more than 30 surgeries, including hernia surgery, jaw surgery, cleft palate repair and the removal of tonsils that had grown so large they affected her breathing. As Jess put it to me with a bit of humour, she said, "Let's just say I've had a lot of anaesthetic." 30 surgeries before the age of 18. But what really struck me with Jess when we spoke wasn't just the surgeries, it was how hard it can be for people with rare diseases to navigate the health system. Jess says there is often no clear place to go. Because the condition is rare, patients can struggle to access a multidisciplinary team. She told me that there's very little transition care between childhood and adult services, meaning people that can suddenly find themselves trying to navigate a system on their own. Jess isn't interested in blaming anyone. What she wants is something better for the future. She wants to advocate for people with rare diseases. She knows children with the same condition who are not getting the help they need, and she wants to help connect families and push for a system that works. And that's exactly why we held a forum last week. It was very well attended by the community, and there was a lot of participation and discussion online and by emails I received. And so I just would very much want to give an opportunity during this debate to shout out to Jess Short, who is a remarkable individual and a fierce advocate for people with these conditions. And so, arising out of the forum, I got another email last Friday, a couple of days after the forum, from another legend in our community, Kerry Millman of Ormo Hills. And Kerry wrote to me, and I spoke to her today, and she's very happy for me to read it out. There's a couple of things about this letter. She is also a fierce advocate, and so in this email she is advocating for the treatment which she receives to be included on the PBS. And there's a couple of things I'll say to that at the end of it. But I think this really gives an insight into what it means to have a genetic testing to determine your condition. She said, "Thank you for the opportunity for the session. Unfortunately, after treatment and dealing with the M1 car park for 2 hours trying to get to the treatment this morning, I was unable to attend in person. I did start out listening though, but I'd like to put into words what I think, and so thank you for the opportunity to have a voice. A little about my rare disease. I was diagnosed in 2023 with a rare cancer, gallbladder cancer, luckily found after going to make my regular blood donation and for them to tell me my iron levels were too low and to go and see my GP. Long story short, I've been through a couple of surgeries, oral chemotherapy, then more intensive chemotherapy and immunotherapy when the cancer spread in 2024, all through the public system. I do have private health, but the call was taken that under the public system I would be in more of an umbrella situation. Last year my cancer metastasised again, and thanks to genomic sequencing, targeted treatment and HER2 was recommended as my best hope to beat this once and for all. 2 pathways only were available, a clinical trial or private treatment. I tested for the clinical trial based out of Blacktown Hospital in Sydney. However, my tumours were considered too small to qualify. Really, I was a number to the trials people. So by the time my tumours had progressed further, there was no spot available on the trial. So private was only available to me. Luckily for me, at a very young age, my financial advisor had set me up with a raft of insurances, one of which I am now using to pay for the $10,000 it costs me for every second treatment, which I will have every 3 weeks for the next 2 years of my life. The treatment is working. I'm 6 cycles in and there are no signs of tumours now. I literally had this news today, which is amazing and very exciting for someone told they have 12 months to live. But do you know the same protein that Enhertu is targeting in breast cancer patients, if I had breast cancer, I would have access to this drug at $25 a cycle. The National Breast Cancer Foundation advocated for this drug for the 1,700 patients each year who have this same sequencing and need of targeted treatment through Enhertu for this drug to be on the PBS. The power of a powerful advocate for a recognised disease, but I am left out of this as a rare cancer battler. Now, Rare Cancers does what it can. The organisation Rare Cancers does what it can. Rare cancers themselves, as a combined cancer, are the 3rd largest group in Australia, but there are multitude of needs and not one high-profile group. And nor do I have access to a cancer care nurse. I did under the public system at Gold Coast University Hospital. That cancer nurse was there to answer questions, but was a reactive support service, not an advocate or a support person for myself and my family. I've had to seek out, resource and upskill myself in medical terms and knowledge bases, as I'm sure you're hearing, because there is really no one out there who can do it for me. And so what stands out from Kerry Millman's email is that, number one, my contribution to this debate would be insignificantly small in comparison to the contribution that she is able to make to this debate. And so it is in her words that I think that we sum up exactly what is going on here. The second is that quite potentially the private insurance which she has relied on to save her life would have been denied to her, or her condition would have been excluded had insurance companies been able to use earlier test results to make that exclusion. The third thing that I'd say too is that the PBS itself, she's right to be advocating for the PBS, and it's great that I feel just amazingly privileged that I can be a voice for people in my community in this place. And the PBS, as the Minister for Health made the point today, that since we were elected, we've listed more than 400 new medicines onto the PBS. And this month, just as an example, he said that we listed a medication, a treatment called Ultravirus, which is a relatively rare condition affecting, which treats a relatively rare condition called myasthenia gravis, a condition which impacts only about 3,000 Australians, but impacts those 3,000 Australians profoundly. And so it is, I think, that this government is and we as a society are living with a time where treatments are coming on to the market at an unprecedented pace every single month, and these treatments are often are specifically targeted to the genetic testing which is identified through that test result. By the way, Kerry climbed Mount Kosciuszko last year to raise $2,600 for Cancer Australia. And so it is people like Kerry and Jess Short that really inspire me to get up here and talk about what it means to protect their right to health insurance through the law. Because the difference between going through genetic testing and a normal route of a diagnosis is potentially, there was a study done there, potentially going through the normal route is extremely frustrating. It can take up to 5 to 7 years, and it can cost anywhere from $10,000 to $40,000. The alternative through genetic testing is that it can take weeks or maybe at most months, and can cost anywhere from $1,000 to $7,000. Apart from the impact that this has on the individual, the impact that this has on the economy as a whole and on the productivity of the economy, as well as the cost of the health system, has got to be profound. And so it is in the last 3 minutes of my contribution that I come to specifically why this legislation is so important. In some ways, you'd think that it goes without saying that it should be illegal and it should be unlawful for insurance companies to use genetic testing against somebody to deny cover. But the fact is that in the community there is a perception that the insurance companies will do just that. I don't know where people got the idea that insurance companies are untrustworthy. And so it is essential that people have the confidence that they can undertake that diagnosis without fear of then being excluded from insurance cover, and that in the most severe way possible, by criminalising it as an offence and not just making it a civil penalty, that truly sends a message to insurance companies to do the right thing, and so with that, to give people in the community the confidence that they can get the cover that they need, and so it is that through that process, through that philosophy that I have in Ford, to listen to our community, to fight for our community and to deliver our community, I think this is a great example of being able to identify an issue which is much bigger than I would have ever thought before. As I say, as Kerry said, actually, cumulatively, rare cancer is put together the third most common type of cancer. That rare diseases are not rare, that even though it may affect 5 in 10,000 Australians, when you put it all together, there's probably 13,500 people in Ford alone who are suffering from a rare disease. And so it is by listening to the community and then fighting for the community, and I should say doing what really little I can to help people like Jess and Kerry fight, then I think that we as a parliament can deliver, and that's what this legislation does. It delivers certainty to people to go and get the diagnosis, to go and undertake the testing that will potentially not just save their life, but give them a quality of life that they wouldn't have had otherwise. And to that I commend the bill to the House.